Nearly every dollar of growth in federal spending is driven by growth in healthcare spending. That's Medicare, that's Medicaid, that's the Affordable Care Act. All of that is driving our deficit and debt to unsustainable levels. And it will be very important for President Trump to address this big problem that's affecting the affordability of healthcare. There's going to be a lot of action in Washington over the next 4 years on the problem of high drug prices. When you have a unified Republican government, there's much more likelihood of legislation coming through Congress. You could regulate prices. Medicare could negotiate drug prices. That could happen. You could see someone like Donald Trump propose that. He has proposed that in the past. The free market options, I think, are some of the more interesting ones. How can we actually reduce the cost of medical innovation so that innovative drugs can get to market faster and they don't have to cost as much as they do today? By eliminating, for example, antitrust exemptions that prevent insurers from collaborating in negotiating prices in a given state or a given county with those pharmaceutical companies. One area that I get asked a lot about is what's the future of the Medicaid expansion? The Trump administration directly could have a big impact if we expand coverage to the uninsured in a more consumer-oriented, patient-centered way. Under a new system, a modernized system in which you deliver tax credits for those individuals to buy private insurance and health savings accounts. We've seen this, for example, over the last several years in value-based insurance design, sharing risk between insurers and hospitals and other healthcare providers, in which if you deliver a certain coverage or episode of care at a lower cost, both the insurer saves money and the hospital saves money. One thing that's going to be really interesting to watch is how the FDA evolves under President Trump. The way our healthcare system has improved the most over the last 50 years is not necessarily because more people have had health insurance, but because innovative medicines have helped people live longer. The FDA is the barrier, the threshold for innovative medicines, innovative therapies. But there are areas in which it's gotten too onerous, where the FDA's culture has gotten too risk averse. If you work at the FDA and you don't approve a drug or delay the approval of a drug, you're never hauled before Congress. You're only hauled before Congress if you approve the drug and something goes wrong afterwards. So we've got to create a safe harbor for the FDA to say, you know what, we can do more to allow innovative medicines onto the market, being aware of the risks that any new medicine will have.